Okay, good afternoon, everybody, and thank you so much for joining us for our continuing education training. So we do have Stonebridge Behavioral Health. We have a few. So I know we have Mackenzie, Andrea, and then, correct me, I have Anne as well.
Nancy.
Nancy.
Dr. Anne Marie Hernandez
Okay.
won't be joining us today.
Okay. So they go over psychological evaluation. So as you know, some of our kids do go through them. And so if you've ever wanted to kind of have like a breakdown of what kind of like going through it, I know like Brenda did have questions about the percentile and whether or not it was considered to be good or not based on vocabulary. So it's just something so that way you're able to understand it a little bit better in like just plain terms of, hey, this is exactly what this means. So I'm going to go ahead and I'm going to let them get started. If you are on the training, though, as always, I will put your continuing education in for you. If you are rewatching it, you just have to reach out to me and let me know that you did watch it, and I'll also go ahead and put that in for you as well. So I'm going to go ahead and let them get started.
Awesome. Yeah, so we'll share our screen. So, okay. Let me just make sure it's doing. Okay. Can y'all see the presentation that it should be just the first screen there?
So I can see the one where I guess it's kind of like the speaker notes one. So
Okay.
okay,
Here
there
we
it
go.
is. Okay,
Awesome. It
perfect.
does weird things on Zoom, so thank you. Okay, so welcome everybody. My name's Mackenzie. I have Nancy, our operations manager here, as well as Nikki. She's one of our LSSPs here. So she'll be helping us kind of break down the psychological evaluation. And Nancy and I can kind of go over any general information about, Stonebridge and, what a psychological evaluation is and what we do here. So, of course, we'll kind of talk about, who we are, what a psychological evaluation is. Nikki will help us understand what a psychological evaluation is and any details of that, how a psychological evaluation can help us, and then, some details about Stonebridge, and then we can open up this meeting for a discussion and any questions. So I can pass this over to Nancy. She's been here for like 13 years with Stonebridge.
Janine, my audio went off. This is Janelle.
Oh, we can hear you, Janelle. Can you hear us?
Janelle, can you hear us?
She's on mute.
Yeah, Janelle, you're on mute. I don't know if you could hear. I'll text her. That's fine.
Okay. So Stonebridge was founded in 2003. Stonebridge Behavioral Health serves as a stable foundation in the field of mental health, providing comprehensive psychological evaluations.
Sorry, I messed that up. Okay, here we go. Why did it do that? Oh, goodness. Here we go. Okay.
Let's see. For individuals across Texas, just as the bridge offers a reliable path for travelers, our services ensure a structured and supportive journey towards mental health.
I don't see the screen share. Sorry.
Oh, it just says I'm sharing it.
I can see it on my end. Like,
oh, okay, got it. Sorry, thank you.
Okay, sorry guys. So what is a psychological evaluation? So a psychological evaluation is an assessment where a licensed mental health professional, so typically a psychologist, will assess cognitive, emotional, and behavioral functioning to help with the diagnosis, guide treatment, and provide support through interviews and structured assessments, where Nikki will kind of go over that here in a moment. But typically, a psychological evaluation, when an individual is recommended for these, it's with, persistent difficulties in thoughts, emotions, or behaviors, And these are recommended when, these behaviors, moods, feelings are impacting an individual's daily life, typically in a negative way, or even work, relationships, and their overall well-being. Some of those symptoms can include, difficulty managing those emotions. So if they're experiencing anxiety, sadness, anger, struggles with their memory or focusing, behavioral changes as well, struggles with daily functioning. So again, maintaining their work schedule or school, any responsibilities, trauma or stress reaction, so nightmares, heightened anxiety after an event, and just worsening mental health treatment even after you're still going into therapy or receiving mental health medication and it's just not working. So these are the components of a psychological evaluation. So this is where Nikki can, I can let you take over and kind of go into detail of what it entails. She's the one that really kind of helps the psychologist in the testing. So I can let you kind of take it
Yeah,
over.
and I know you guys had some questions in regards
Okay.
to like what IQ test means,
Mhm.
like the different types of IQs that testing that we use. So when we do a psychological evaluation, there's usually two providers that do the psychological evaluation. One, we have the PhD, which writes up the report, and then we also have an LPA or a psychometrician who kind of assists the psychologist doing the testing. So they'll do more of the hands-on tests, like the IQ test, the ADOS, which is for autism testing, and just different types of testing that is needed throughout the day in regards to the client that we're seeing. So I'm not sure, Nikki, if you did your own presentation or did we add it here?
She added here, but yeah, you can, I'm sure you have some, information to share. And let me know if I need to click or if you want to add to this.
Yes. If you go to the next slide.
Sure.
Yeah, so I'll just hop on to number 2, testing. So typically the testing, can you hear me?
Yes.
Oh, I think it says my connection is unstable. Can you hear me though?
Yes, we can hear you.
We can hear you.
Okay, perfect. So understanding scores and percentiles. So typically the assessments that we use are like the WASI-2. It's a brief cognitive assessment. So it's mainly time and in some tests, we typically, sorry, I'm hearing some background.
Yeah,
Andrea, I don't know.
Typically we use
I don't know if it's easier for you to turn off your video. I don't know if that's what's causing it to be like, because I can hear you laggy a little bit.
Okay, let me try that. Okay, I turned the video off. So yes, IQ tests that we typically use would be the WASI-2. We also use the ABAS, which is more of adaptive functioning. So kind of looking at independence skills of children and adolescents. Can they navigate their community areas? Can they navigate things like the home setting, the school setting? And those all provide us with what we call standard scores. So standard scores usually have a range from like the lowest score typically is like 40 and then they go to above 130. And then the average or the midpoint within that scale is going to be 100. So that would be where the typical population performs from either a score of 85 up to 115. That's considered average, with that average main score being 100. So anything significantly deviant from the 100 or significantly far from the 100, either lower than that or higher than that is typically rare, but we do often see a lot of the scores on either ends of that 100. So I'm going to share, if you want to go to the next slide, that probably has a visual that is very helpful with picturing these scores. So if you look at where it says standard scores, 85 to 115. So score 4 through score 7, those would be your typical or average scores. And then anything below scores of 85 are kind of scores of control score was a 100. Those would tell us there's more concern with his verbal comprehension or vocabulary, crystallized intelligence type things. So this visual provides a lot of information, and it's helpful to refer back to often, even for me, who's been using these assessments for a long time. The percentile is also here. So if you see percentile rank, those numbers are also on that third row, and it ranges from 1 to 99. So if you look at score number 2, which falls at a 70, that one falls at a percentile rank of 1, which would be significant concern, because a percentile rank tells us this person did 1% better than everybody else that took the same test, which means 99% of people did better than them on the assessment. So that would kind of raise flags for us. So anything typically with percentiles lower than a percentile of 20 is also would tell us there's some concern here in either their adaptive skills or their cognitive ability, or things like we also use the RAT, which looks at reading, writing, and math, and it also uses standard scales and percentiles. Any questions?
So I think, yeah, I think this was the part that Brenda, our program director, she kind of like showed me that little, I think it's called the WASP, right? I think is what it is. And I was just trying to make sure, yeah, because I think that one specifically for vocabulary, I think it was like a 7. So that means the percentile rank was 7. So that means she would be considered low, extreme, below, or average, correct?
Yes, correct.
Any other questions before we kind of move through this? And of course, we can still open it up for questions, but okay. So I can kind of go through this. So how a psychological can help you. So, we get a lot of questions from parents and caregivers asking, what's the point of getting a psychological evaluation or just getting evaluated? What does this do? So, a psychological evaluation identifies and helps to diagnose with mental health conditions. So, some of the mental health conditions that we do know of, like ADHD, autism spectrum disorder, depressive disorders, any disruptive impulse control and conduct disorders, and then trauma. It also does help determine eligibility for services. So if a child or an individual does need counseling, medication management, any therapy, we can, get them in the right direction. And most of the time you will need a diagnosis for some of those. And then psychoeducation support. So this is offered here at Stonebridge for those, that needs connection after getting diagnosed. So, if they need help with getting connected in the community, finding a good therapist, or finding, a clinic for ABA, or finding a psychiatrist. So we can help with that as well. So,
So does anybody have any questions for Nikki or Mackenzie? In regards to like IQ testing or any clinical questions?
I have a question. So, like Stonebridge did a psychological on one of my kiddos, and there was a diagnosis of autism. But then the school didn't agree with they did their own psychological and didn't agree with the diagnosis. So, and it's happened to us a couple of times where it's kind of like contradicting. We're like, hey, this kid does need services, or like not based on the one we did. So it was just very confusing for us.
Yeah,
Because
the schools have their own rules, and Nikki is probably more experienced because she did work in the schools for a very long time. So she can probably give you some recommendations on this. So Nikki, when the schools do their eval and we do an eval and they're not accepting the diagnosis, what would be like the next steps to take as a parent?
So yes, typically the schools they do have a different set of criteria for autism. It has to significantly impact things like verbal ability. So does the child speak? Are they nonverbal? What level of verbal ability that they have? And then they have to also have difficulties with social impairment, so difficulties sustaining friendships, making friends, difficulties with initiating interactions, and then they also have difficulty or need to have difficulties in nonverbal communication. So typically with the schools, they have to meet all three of those criteria. If they meet one or two, they wouldn't qualify as a student with autism. I have come across a lot of those scenarios where the child often has a medical diagnosis or a psychological diagnosis of autism, but they don't meet the criteria in the schools. And typically, the parent can ask for an independent evaluation. So the school will provide the parent with various resources or other psychological offices or behavioral health offices that can conduct these evaluations, taking into consideration the school or the TEA criteria. And then that is a parent's right to seek out that evaluation. It is a lengthy process and it does vary by district, but that is parents' option. Otherwise, they can always come together at the ARD meeting and then kind of, look at other needs that the child might have and how, if they're already in the program, how can we, address these needs without having that eligibility on paperwork, or, he might have some difficulties with nonverbal communication, so might need social skills, things like that, but it might fall under a different eligibility. Does that help?
Question about, the impact that changing schools and disrupting the school environment for the child has had, and if y'all notice that impacting their scores. I've got one child who was in 8 different schools over a 5-year period, and she's very low on her reading abilities. But it seems to me like she's never had consistency in order to be able to be successful through that consistency, because she changes schools and curriculum so much. So do y'all see that impact?
I have often seen that impact because, again, like you said, the consistency is not there with the instruction, or they move to a different school and then they're covering a different, maybe they're ahead of the other school that the child was at. That is unfortunately one of like the exclusionary factors, I guess, for school-based evaluations, is we have to look at the students. Do they have sporadic school attendance, and how does that impact the student in terms of, is this a disability, or is it the fact that they haven't had consistent access to quality education?
Mhm. And I think it's I mean, a lot of the times it's probably often seen with our foster care community, because, a lot of the times they move houses a lot and have to go through different schools and things like that. So I think, but if you have a child that they're not accepting the diagnosis, I would probably advocate for an IEE, which is an independent educational evaluation. But I believe by state or by law, they have to consider the IEE for the child. But like Nikki said, it is a long process, but it is something that they will give the child if that's something that the parent is advocating for. Okay, any other questions for Nikki or Mackenzie before we move on? All right, so in regards to details, how it works when referring to Stonebridge. So the first step, usually we get a call or we get a referral through email. We do have our intake specialist guiding them through the process. We do work a lot with Child Protective Services, foster care agencies. We do a lot of work in the community with pediatricians, therapists. So a lot of our people that call sometimes are not really they don't know what to do really. They'll call and just say like, they told me to call, I'd come to you guys. But some of them have already had testing within the year, or they've already been diagnosed. So it may be that maybe they're looking for therapy or they're looking for ABA. So we try to kind of take them, just educate them on what a psychological evaluation is, and if that's something that they're not needing, we'll give them resources with like for therapy services or ABA. But if it's they are needing a psychological evaluation, we gather their information, do an insurance check, make sure to verify coverage and submit any authorizations if needed. Then the next step will be to get scheduled for the psychological evaluation. It is a lengthy process for forms for the parent and for the child if they're 8 and above. The child has some forms to do of their own as well. So we try to email those or mail them ahead of time, and ask for those forms to be completed before the day of their evaluation. Usually, evaluation day, they meet with the specialist for testing the diagnosis. It can vary from an hour to about maybe 3 to 4 hours, depending on the child or the client. Sometimes they'll have to return because we weren't able to do the testing that we needed on that day. For example, if the psychologist kind of sees signs of autism, usually we would have to bring them back for an additional test on a different day with a different provider. And then once they come in for that, we kind of just put all the information together. The provider writes up the report, and usually for our foster care CPS, we send that back to the caseworker for review for the final report. And if it's coming from like a parent or a pediatrician, we usually send our reports back to the parent. And then we also do provide them with to call us back to set up a feedback session with one of our feedback specialists that are at the, what is
They're
it?
like internship level.
Their internship levels for like an LPC. So they are at their master's levels once they come back and they have a feedback session. We go over the full report. We let them know what the diagnosis means. We let them know what the IQ score means. We kind of set them up for the next steps within their journey. For example, it can be therapy, ABA, maybe it can be, you need to find a psychiatrist to see in regards to like what insurance they have. We try to set them up with the correct services that they're going to be needing next. So as far as insurances, we do accept most insurance plans, most Texas Medicaids, commercial plans, which are private insurances, and TRICARE, and we also do private pay if needed. We do telemed services throughout Texas, and our offices are in San Antonio, Lubbock, Texas, and Houston, Texas. Thank you, guys. And if you guys have any questions, we can kind of just open up the floor if you guys have any additional questions at all.
I have a question. This is Shauna. What kind of filtering process do y'all use when you have children, mostly like the teenagers, who aren't real cooperative when they do their psychological evaluation or don't put any effort into their responses? I work with several teens, and I know they don't give honest answers or put any effort into that. So how do y'all filter that out in order to come up with a diagnosis?
Nikki, do you want to?
Yeah,
Yeah,
I can answer.
she's the one that does the testing.
So
more experience with it.
So typically we do get that often also, where students or children are disengaged, or adolescents don't want to be there, don't want to provide responses, even if you're probing and asking questions and explain to them like we're in this, we want to help and provide appropriate supports that are individualized or tailored to your needs. But oftentimes we as examiners or professionals remember that we're kind of doing a snapshot in time of the student's current functioning. So whether they might communicate like, oh, they don't want to be a participant in the process. But I think just remembering that it's a snapshot of the student's functioning or the child's functioning, and using other interview or other questions that we can to kind of gauge whether, it's more of a disability factor or, they have the skill. It's just maybe right now they don't feel like participating or answering questions. And maybe with another trusted adult, they might feel a completely different way. So I think that's why it's important for us to gather various forms of information from different individuals so we can have a better picture of the child or the adolescent.
Thank you.
Thank you. Sorry, I couldn't unmute.
No, you're okay.
Thank you.
Does anybody else have any other questions? I just wanted to ask, I liked the little chart where it kind of showed. Is there any way that you'd be able to like share? I mean, I don't know if that's y'all specifically, if y'all got it from somewhere, but maybe sharing that with us kind of be helpful if a volunteer ever kind of asks this. Then I'll kind of have it like on hand, but I think that'll kind of be helpful to know exactly when they're reading the percentile of where their kid would fall. And it might help them understand a little bit more.
Yeah, I can send it to you in an email. I can follow
Okay.
up with that. Yeah.
Awesome. Thank you so much.
Yeah.
Anybody else have any other questions? No?
Yeah,
All
and
right.
I mean, like I said, we are very open to having feedback sessions with the families, or if they have like certain questions on the report on what something means. We understand that our reports sometimes are very long, sometimes overwhelming for someone. So if we have to break it down, just feel free to give us a call, and we're more than happy to set up that feedback with the parents or with the CASA volunteers as well.
Thank you. That's good to know. Sandra, I saw you come off, but I didn't know if you were going to say anything.
Yes, ma'am. Can you hear me?
Yes.
Mm-hmm.
Okay. No, it's I kind of came a little bit late, but I just had a question, and maybe you already have said it and I didn't understand it. But when a child is removed and goes to foster or to a family member, is the child like, do you get the call that from the school or the daycare that child is in need? And if there is no insurance, since they're placed with the department, is that who takes over like paying for this service? Or
Yeah, usually when a child is removed and put into foster care, they automatically get Medicaid, which is the superior foster care. If it's not like the day of, they usually put it back to the day that they got removed. So even if it's not showing up the day that we check TMHP, the systems that we check, or Superior Health Passport, we usually know that it's going to backdate to the day that they were removed to Superior Foster Care. And we do accept Superior Foster Care, and they are like covered at 100% for psychological testing.
well, thank you. Just because I've seen some of my kids that I have advocated for, I do see that when I ask them about the services, I see that there's Stonebridge, so I do see that they have it, and I have seen that the kids are doing really good. Like when they started, like they're reading or your services are very, very are used very good for the children. So I just wanted to say thank you and for the information, because I have seen and reports that they're receiving your services, and the kids are advancing. And if it hadn't been that they were tested for because they probably would have done it at the school, but when they're removed, that they recognize those needs for the children, and it's also a good service for them. So I thank you for that.
Yes, thank you. Yeah, usually when they're, very recently removed, sometimes it is good to get a psychological, but other times it's not, because they were just removed. They're just going through that trauma. We're about to, they probably went through so many people already that asked them the questions that we're going to ask them as well. So it may be that we don't see them until maybe they're stable in a home with foster parents, and they've been in there for a couple of weeks and a little bit stable, and then the foster parent brings them to us. But other times it is very important for early intervention. Like we work with St. PJ's, Boysville, so kids that have just recently been removed and into emergency shelters. But it may be that because a foster child receives one psychological evaluation every calendar year. They get 8 hours of testing. Maybe we see them in the beginning and we weren't able to get as much information because, they weren't open, they weren't comfortable, they're just got removed from their biological family. So it may be that we just do a brief interview, maybe some testing, but we do recommend for them to return to us maybe 6 months from the day that we saw them, and we kind of continue from that first evaluation and do more testing because we only billed maybe like 3 hours. We didn't bill the whole 8 hours because we didn't see them for everything that we needed. We're going to recommend for them to return in a couple of months. And we kind of just put all that together and just see how they're doing within those 6 months and get the real testing that they need. Maybe they're more open to talking. And so sometimes we kind of just do partial testing and then have them return in a couple months when they're a little bit more stable.
Thank you. All right, if we don't have any other questions, I just want to thank all of our volunteers for jumping on to be able to hear what Stonebridge had, to be able to present to us so that way we can better serve the children that we do advocate for. Nancy, I'm going to say Nikki because that's what she said. And Mackenzie, thank you so much for taking the time out of y'all's day to just briefly educate us a little bit more on what the evaluations all entail. We really do appreciate it. And anytime that y'all, want to send any information that might be helpful towards our volunteers, you can always send it to me and I can always push that out. But I do want to thank y'all so much for presenting to us today. And I hope that everybody else has a good rest of their day.
Thank you.
Thank
Yeah,
you.
let us know if we can help with anything else, or if you have other presentations, we'd be happy to help.
Yes,
Thank
thank you so much.
you.
Bye.
Bye.
Bye.